What's up, you guys? It's your boy Miguel giving your daily dose of radiation. In today's video, we are covering how the beloved night shift gives you the flexibility, especially if you have kids like I do. And as long as your other partner works day shift, gives you the most coverage and flexibility for like kids, appointments, for everything. It is, as long as you're willing to pay the price, you can have you almost don't even need daycare if you have little ones, but night shift, whoever's working the night shift will kind of pay the price. It is kind of hard on your body, but there's been so many times I have my kids in daycare, they're little ones, and essentially depending on if they're sick, if they have appointments, like if they're sick, I will literally head home and we'll do a little swap with my lady. She's a nurse, she goes in, and then, because if you're unfamiliar, if you have little ones, if they go to school, if they're sick, running fever, school will not allow you to send them. So I will have to stay up, take them to their doctor's appointment, take them to urgent care, do whatever I gotta do, and I'll just keep them with me. I mean, I maybe will sleep a little bit, maybe 1 to 2 hours if when they nap or whatever, or sometimes not at all, and I'll just kind of push it throughout the day. And then you can kind of have coverage. I know some people don't have a lot of family members or anyone trying to help them out, so it gives you the flexibility. Appointments too. If I've seen so many times where there's people who both work day shifts and they have to schedule a bunch of stuff when they're off, or sometimes emergencies happen and they have to call off work constantly because of kids, because of appointments, and the night shift, you ain't gotta worry about none of that. You can either do it when you're off, or if you're still working, you can still get stuff done. I mean, as long as you give up a little bit of sleep, probably it'll get done. There's been so many times where I've been thankful that there's been like different eras of my life where my kids would just be constantly, every week, every month, they would constantly begin sick. It'd be one kid, it'd be another kid, and I would think back, I'm like, if I would work day shift, there have been so many days out of the year that I would have had to miss because of these kids, or my lady would have had to miss work, or it would cost, it'd be kind of pretty hard on us. And thankfully I've been able to just it's just literally just giving up sleep, and then you just take care of what you gotta do for your family. But it gives you so much flexibility as long as you're willing to pay the price a little bit. I mean, obviously, if they're sick that like for several days and you're constantly giving up sleep, I mean, by the end, I work 7 on, 7 off. Sometimes I've worked crazy amount of overtime. Like sometimes I work like 25, 26 nights straight right now. By the end, maybe by the weekend when she's off, like my body will start to feel it, and I'll just like, it'll be like 1 or 2 days where I'll just pass out, like, and I'll sleep. I have to sleep a lot more, and then I'll just kind of recover back. So you do feel it, even if it's like 1 or 2 nights, or I guess days that you stay up. You don't feel it the beginning of those, like the following days. You feel it a little bit when you wake up, even if you get a 1 to 2 hour sleep. But it's like at the very end, like you kind of feel like of your workload, you'll kind of feel it, even at work. Like even with the energy drinks and the amount of caffeine I drink sometimes, like you'll still be a little bit struggling overnight. So usually I'll try to avoid carbs, or just fast overnight. That will kind of make it easier, so you don't, because I've noticed when I am tired and then I throw a bunch of carbohydrates in the middle of the night, like my body will just try to pass out. So if anyone out there is young, has kids, has little ones, and struggles with that, I would highly recommend working the night shift. I mean, it does kind of come with a price, but it has helped me significantly, so much. I mean, even outside of just like the kids being sick and stuff like that, even like, because I gotta work 7 on, 7 off, so every other weekend I have to work. So there's sometimes on certain weekends, maybe we have family members having a party, maybe certain events are happening outside of my city, and I'm able to kind of rearrange my sleep a little bit, where I'll sleep more a few days prior, and like that day I'll just go out with my family, go do whatever I gotta do. Obviously I may not sleep at all that day, or I may sleep 1 hour, 2 hour, and I'm willing to pay the price a little bit. But I had a wonderful time with my family doing whatever family stuff we had planned that day. I mean, I do pay the price and then you'll be tired, but it is kind of worth it, because like some people, you can't, like there's certain stuff like you don't want to miss. So there's always a price to pay. And yeah, I hope this video is informative to all those people, not just for people who do x-rays, but just night shift in general. That is something that anyone can do to help them. I know some people struggle to work night shifts, and it all depends on your job. I'm beloved Xray, and it makes it pretty easier. It's not too bad on me. I work at a trauma 3 ER, and yeah, it's been your boy Miguel. See you on the next one.